I'm Dr. Darren Rodabough. I practice in the greater St. Louis area. I've been in private practice for about 15 years, and I've been a SureSmile user since 2009. For my DIY aligners, I'm using an Essex Ace 030 plastic. And what I like about it is it has flexibility. It's a little bit more flexible than what you would use for a plastic with retention, which you need if you're going to move the teeth. The other thing that I like about it is it's a very clear plastic, and so cosmetically the patients really like it. I have the ability to move the teeth with a flexible tray. It allows the right forces to move the teeth in a reasonable amount of time. The other thing that I like with doing my own aligners is that I have the ability to print out the number of trays that I want to. So if I'm a little worried that a patient may not be tracking super well, I don't have to print out 30 models to begin with. I may just print out 8 or 9 models, and once everything is going well, I can then print out additional models. I don't want to print out models that potentially I'm not going to be using because that's a waste of cost. So one of the nice things with using the SureSmile software is that I have the ability to do a hybrid case where I can do trays on one arch and I can do brackets on another arch. Most of the time for me, I'll do trays on the upper arch and I'll do brackets on the lower arch. Normally that's the case if the bite's too deep, if I'm worried really about opening the bite, the vertical to the right height. I have the ability through the software to do the trays on the arch that needs the least amount of treatment, and then do wires through SureSmile technology on the lower. But the ability or the goal is to finish those arches at about the same time. And the ability to do that and meld those two hybrid modalities of treatment is something that's just not available in other systems.